If you're watching this video, you might have a missing tooth and are wondering about the best way to replace it. Maybe you're weighing your options between a dental implant and a bridge, or you just love learning about dental procedures. Whatever the case, I'll break down both treatments, their pros, cons, and what I personally recommend at the end of this video. What is a dental bridge? A dental bridge is a restoration that fills the gap left by a missing tooth. It works by anchoring an artificial tooth to the adjacent teeth, which are reshaped to support the bridge. Pros of a dental bridge. Longevity. A well-placed bridge can last 15+ years, with studies showing a 90% survival rate over this period. Quick procedure. Bridges can often be completed within a few weeks, or even in a single visit if milled in office. Fixed solution. Unlike removable dentures, bridges are cemented in place. Lower upfront cost. Bridges typically cost less than implants, and insurance often provides better coverage. Cons of a dental bridge. Bone loss. The jawbone under the missing tooth isn't stimulated, leading to gradual bone resorption, altering healthy teeth. To place a bridge, adjacent teeth must be reshaped even if they are healthy. Risk of future issues. Supporting teeth can still develop cavities or need root canals, compromising the bridge over time. Hygiene challenges. Cleaning under a bridge requires special flossing techniques or a water flosser. What is a dental implant? A dental implant is a titanium post surgically placed into the jawbone, acting as an artificial tooth root. A crown is then placed on top to restore function and appearance. Pros of a dental implant. High success rate. Studies show a 98% survival rate over 15 years. Preserves bone. Implants stimulate the jawbone, preventing bone loss. Independent tooth replacement. No need to modify adjacent teeth. Easier to clean. Just brush and floss like a natural tooth. No risk of cavities. The implant itself can't decay, though gum health is still crucial. Cons of a dental implant. Higher cost. Implants generally cost more upfront than bridges. Longer treatment time. Healing and osseointegration. Bone fusion can take several months. Surgical procedure. Since it involves surgery, some patients may not be candidates due to bone loss or medical conditions. Which one is better? If I had to choose, I'd go with the dental implant, assuming I'm a candidate. While implants cost more initially, they tend to be a better long-term investment, preserving bone and avoiding issues with adjacent teeth. That said, bridges are still an excellent option, especially in cases where implants aren't feasible. Before making a decision, consult with your dentist to determine which option suits your dental health, budget, and long-term goals. If you found this video helpful, give it a thumbs up and consider subscribing for more dental insights. Thanks for watching.